Grief work can take many forms and can bring some of the greatest rewards of the program. Some grief work involves journaling, in which we write about incidents in our life and reflect on feelings that we had at the moment. Many adult children can recall childhood acts of abuse, neglect, or rejection without emotion. Others will talk about the abuse or neglect as comical or unimportant. Our experience shows that the emotion is there, but it is stuck behind our ability to deny the past or to recall it without clarity. We can have the memory of the event, but we block the feeling associated with it. This is a form of dissociation. When we journal about a childhood incident, we slow down and think about how we must have felt at that time. If we struggle with this exercise, we think about how one of our children would have felt in that situation. If we have no children, we think about how a child would feel in our place as a child. We ask members to do this exercise several times over many days and to be patient. The picture exercise is another proven method to help recognize and release stored loss or grief. Some counselors will ask a client to round up several childhood pictures and bring them to a session. An ACA sponsor can do this type of work as well with a sponsee. Many of these snapshots are grade school pictures that we had forgotten. The pictures come into sharper focus when discussed in therapy. Observing ourselves in the 2nd or 3rd grade, we noticed how shy, giggly, and sensitive we had been as children. We had feelings and we had loss. Another form of grief recovery is known as sculpting or role-playing. This is known as experiential therapy. In this type of grief recall, we are usually in a counseling setting with other clients helping to reenact a troublesome scene from our past. This is a profound and powerful tool to tap into hidden loss and shame. Finally, some grief work takes time. After years of recovery, we may find ourselves weeping over a movie scene that reminds us of a childhood stage in our lives. Or we find ourselves watching a child play quietly in a schoolyard. We observe how the child is focused inward and full of imagination. We think about our own childhood innocence. We make a connection to our inner child. The tears come. As a result of working step 5, we seem to breathe easier and judge ourselves less harshly. For some, our posture changes. Our head is up, and we make eye contact with people. We feel lighter in our step and in our breathing. We feel a greater connection to our higher power.